Hello, and thank you for joining today's webinar. We will be starting in 5 minutes. Hello, and thank you for joining today's webinar. We will be starting in 3 minutes. Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for one contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of continuing nursing education by the American Nurses Credentialing Center's Commission on Accreditation. The speakers and planning committee members have disclosed no conflicts of interest. To receive contact hours for this C&E session, participants are required to attend the webcast and complete the evaluation form, which will be emailed to all attendees approximately 1 day after the webcast. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, we will have a question and answer session. You'll see on your GoToWebinar control panel that you can send a message through the questions feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so the message makes it to us. To test out this feature, please submit the state or country you are from. We would like to thank our speaker for sharing his expertise with us today. Our speaker is Charles Kunkel. Charles has over 28 years of experience as a nurse and has held multiple positions in the emergency medicine, pre-hospital emergency medical services, cardiothoracic intensive care units, and flight nursing. He was named Manager of the Year by the Nursing Spectrum magazine in 2006, and in 2009 he launched No Time to Care Solutions, helping healthcare leaders throughout the country to energize, empower, and engage bedside caregivers using his unique and easy-to-follow 8-step game plan approach. In March of 2016, Charles released his first book entitled No Time to Care, A Leadership Guide to Ensuring Caregiver Engagement. In 2017, his book was awarded the Silver Medal Book of the Year by the American Journal of Nursing. Now let's go ahead and get started with tonight's presentation.
Thank you so much for having me. Tonight, I want to talk a little bit about something that we're all aware of, and that is coronavirus. I remember the date when I first heard about the coronavirus. That date was January 16th. I know that date because it was my grandmother's birthday. And I remember hearing about that virus and that it was spreading throughout China, and that people were starting to worry about the possibility of it making its way to the United States. And of course, the first thing that popped into my head is the storm's coming. Healthcare leaders often prepare for many, many different disasters. We prepare for train derailments, chemical spills, active shooters, JACO inspections. But I don't think any of us could have had the forethought to prepare for the COVID-19 pandemic. While waiting for our first COVID patients to arrive, we still needed to maintain our daily workload demands while worrying that each patient we encountered with a cough had the virus. We asked ourselves questions like, are we ready? When these patients arrive, will I be able to see my family? Will I transmit the virus to someone I love unknowingly? Will any of us become a victim? These are very emotional questions that weighed on the minds of every healthcare worker on the front lines. Once those patients began to arrive, our focus shifted to what we needed to do now for our patients and for our caregivers. Caring for the physical needs of our frontline staff was important. Do we have enough PPE? Do we have enough staff? Do we have enough equipment? That was and still is our primary focus. But as we flatten the curve and society begins to resume, our focus will need to shift. We will need to refocus our energies on caring for the psychological well-being of our caregivers, as this pandemic will surely leave emotional scars. It's time to prepare for what I call the second wave. As the number of patients arriving at our front doors subsides, bedside caregivers will begin to deal with the emotional trauma. We need to what kind of support will the staff need? What signs and symptoms must we look for to ensure that our caregivers are effectively coping with their emotions? My hope tonight is to give you some guidance and help you to understand these issues and give you some solutions to help heal our valuable bedside caregivers. But before I get started, what I'd like to do is I'd like to ask you a question, because I'd like to get a sense of what's going on in our country. So the question I have for you tonight is, what is the biggest challenge you are facing today as a healthcare leader fighting this pandemic? I'm going to give you a minute here to fill it out. Pick what you think. Interesting. Well, the results of the poll actually are right about average of what we're seeing across the country. We're starting to move. Our country is starting to move away from some of the biggest challenges that we're facing in terms of PPE supplies and, lack of staff, to a more emotional approach to the psychological well-being of our bedside caregivers. Go back to the slide. Thank you. Okay. So with that in mind, there are some current challenges that we are still working in. And that is, number one, we have a lot of physical challenges that we deal with on a day-to-day basis. There's the strain of the protective equipment that we wear. I mean, those masks, breathing into them all day can feel suffocating. Those gowns are not very breathable, and so you can get very hot, you can get exhausted. There's the isolation, the physical challenge of isolation, the restriction of touching others. We are humans, and that is a very difficult thing to deal with. The long hours that we're working, being isolated at work and not being able to be at home with our family. There's the constant awareness and the vigilance regarding infection control procedures. Washing your hands, remembering to do that, having gloves on, making sure that we're not cross-contaminating things. This is a constant physical challenge, and especially a mental challenge as well. And then, of course, we have longer hours. Longer hours, we're being asked, as some of our coworkers are actually affected by the virus, we have to chip in, and we have to do more time in order to support. Then we have communication challenges that I think many of our facing, particularly leaders, and that is that, we're constantly dealing with rapid policy changes. Sometimes these changes are occurring, weekly, sometimes daily, sometimes hourly. And so that's a real challenge to be able to communicate that, because you have less time to be able to do it. And we have an inability to be able to communicate as well with our patients and our families because of the social distancing and because of the guidelines that are put in place to keep everyone safe. So the thing I have to say to you is this, is that yes, we are going through some challenging times, but we're all doing it together. And as in healthcare, it's always come through in times of crisis, and this is no different. We talk about some of the things that we need to think about as leaders to take care of the emotional aspect of care for our caregivers. I like to talk a little bit about something I call the 5 C's of crisis leadership. The 5 C's of crisis leadership is clarity, consistency, calmness, connections, and confidence. Now I'm going to talk about those in detail. First thing is clarity. Let's talk about clarity. The clarity of our messages are so important in crisis situations because there's so much going on. The first thing we need to do is we need to make sure that we prioritize our messages. People remember things that they hear in a specific order. They always remember the thing you say first. And as you go on, they think they remember less. And so it's very important to put those priority messages in the beginning of your communication. Prioritizing is a very important way to be very clear in the messages that you're delivering. Next, we need to make sure that we craft our messages beforehand. Make sure that if you're doing it, have others look at it, review it, give you feedback. Make sure that the message that you're giving is the right message. Do your best to avoid conflicting messages, and messages need to be short and simple. When there's so much information that's going on, the shorter, the better. Next, we have to assume that there's going to be confusion. Please don't think that everyone's going to get what you say the first time that you say it. People process information at different speeds. And so if you're giving the message, there may be some people that do get it the first time. There are others that may need multiple reminders. We have to maintain positive messaging. When people are under stress, they tend to focus more on the negatives than on the positives. And so in positive messages need to outnumber the negative messages. If at the very least, you should at least add a positive message if you're giving a negative message as well. I'm not talking about the sandwich technique. I'm not a big fan of that. What I'm trying to say is we need to balance that out, because if we give all negative messages, eventually people's minds will not be able to take it. They turn off the information. And then finally, keep your ear to the ground for rumors and hubbub. There are always going to be things that people talk about when leaders are not around. And there are people that are engaged in making sure that their work environment is a culture that is a positive one. And so understanding what's going on in the department will help you to preemptively take care of things that may be growing behind the scenes. So try and keep your ear to the ground. The next C I want to talk about is consistency. When I talk about consistency, I'm talking about having a cadence to your messages. Try to have those huddles or whenever you're providing communication, try and have it at the same time every day. If there's a specific cadence to the message, then people will feel less anxious because they know the time for which they're going to get the next update. This will reduce the staff's anxiety. It will also provide opportunities to answer questions and at that time dispel rumors. Make sure that the messages are the same at AM and PM. Now, I understand that the message may have changed from AM to PM, but if they're the same, make sure that everybody gets the same message. Use multiple mediums. We are working with a multi-generational workforce. Some people will listen to the message when you tell them. Some people will do better if you write it to them in an email. And if there's not private information, use texting. Use things that maybe the younger generation will appreciate in terms of receiving the messages that you're trying to deliver. And then finally, when we're talking about consistency, be vulnerable. It's okay to say, I don't know that answer. What the most important thing that you can do for your caregivers is this: make sure that you commit to finding out the answer and ensure that you follow up with the answer. Next C is calmness. And this is a pretty straightforward one. Staff will always take their cue from their leader. In a crisis situation, they will look to you for their guidance. If you are frustrated, if you are angry, if you are snapping at people, that will increase anxiety amongst your group, and you will see replicable behaviors. And so we don't want that to occur. Now, you're a human being, so it's really hard sometimes to be able to regulate that information. But regulation is very, very important, because if you can regulate the feelings or the emotions that you're having, well, then you won't give off mixed messages by saying one thing, but your nonverbal communication telling something else. And so we need to be able to regulate that kind of information. But again, you are human, and so you have to find avenues of expression for yourself. And that means, finding a colleague that you can just close their door and vent to in these kind of situations. You need to be able to support yourself as well. It's very important. So next, talk about connections. Connections, when I talk about connections, I'm talking about human connections. This is the time when we need to make human connections as leaders with our staff. And I always talk about something called socializing with a purpose. Socializing with a purpose is simply the process of going around and talking to people and communicating with them. And no, I don't mean communicating to them about the virus or about information they need to know about policies and procedures. I'm talking about finding opportunities to just talk to your staff. Find out who they are as human beings. Talk to them and get to know them as more than just the staff member or the job that they're doing. It is important. It is just as important as providing data and information to your staff. Next, relieve people from unnecessary work. Look, there are things that need to be done in normal circumstances that we may be able to remove from the plates of those that are working and reduce their anxiety. We can make connections with our staff by saying, I understand the challenges that you're going through, so let me take some of that work away. Monitor behaviors and check in post-shift. We're going to talk a little bit about the behaviors that you need to be aware of, but frequent check-ins with staff is important to be able to ensure that you're monitoring those behaviors, because some of those behaviors could be quite bad if we don't pay attention to them. And then next, don't stop celebrating the little things. If you find opportunities, if there are things that you're doing that are important, celebrate them. There's no greater time to be able to do that. And then that means, continue to find ways to have fun. And you say to yourself, wait a second, how can we have fun in the middle of a pandemic? Well, many of you have. I mean, just look at all the examples that you see on TikTok videos of, nurses dancing or the kick handshake, or masks that are made up in ways that bring some levity to the day. I mean, there are ways to have fun and to do it responsibly in a pandemic, and this is the time to be able to do it because it is what the staff needs. And the final C I want to talk about is confidence. When we talk about confidence, confidence breeds hope. If you are a leader and you are confident, then people will feel hopeful for what you are trying to achieve. Have confidence that you and your team will get through this. Use language, talking about how you are going to help them get through it. You are going to get through it together. Have confidence that you are doing all that you can to support your fellow caregivers. That's a confidence you have to have in yourself. And then finally, have confidence in nursing as a profession. Because once again, nursing has stood up to the challenge. And so that is a positive thing. So use that as a confident message to keep people going on this very difficult journey. So as we talked about what you can do to help staff, what I want to talk about right now is what you can do to take care of yourself. And in the same way, help others to see how they can take care of themselves as well. Because if you don't take care of yourself, you're never going to be able to take care of others. So there are some basic things that we can do to be able to do this. Of course, there's mindfulness, there's quiet spaces that you can create, and there's meditation. There are many, many different things that we can do to be able to help us during this day. There is a group in, I think, California that wrote me the other day, and they have something called the Respite Crew. And the Respite Crew is a group of nurses that go to different departments, and they'll relieve one or two nurses and send them to their quiet space. Now, they just cover and follow and watch the patients, and then what they do is they'll leave that department and go to the next one, and they call it the Respite Crew. And it's a wonderful way to be able to give a break to those working on the front lines. Maintain social connections. Self-care has to deal with, we are human beings. That human connection is so important, not only at work, but at home as well. Meaningful distraction. We need to focus on the things that we can control. We can't think about the things that we have no control over. That mindset is something that we need to adopt if we're going to get through this very challenging time. We also need to talk about exposing our presence on social media or being a part of social media. Look, you could go on social media today and you can see 17 different descriptions of what people think about this particular pandemic and how we're responding. And it's okay to be informed, but sometimes when we do it too much, it is just a constant pressure on us in terms of our thinking abilities, and that anxiety continues to build up. So do yourself a favor and try to reduce your exposure to social media. And then finally, this is so important. It's okay to not be okay. These are difficult times. And you see, here's the thing. We as healthcare workers, we always try and be our best. We stand up, we are brave, we face adversity. But we are human beings and know this, that it is okay to not be okay. Because the feelings that we are feeling are overwhelming. That's okay. It's normal. And the question is that as we are feeling this way, it's okay to not be okay. But what we need to do is we need to say to ourselves, okay, what can we do to get unstuck from the feelings that we're experiencing right now? And there's something that I want to go over that I learned about. I read this book, and it's called Emotional Agility. The author is Susan David, and I love this quote. Emotional agility is the process that allows us to be in the moment, changing or maintaining our behaviors to live in ways that align with our intentions and our values. And we're going to talk about this 4-step process that she uses in order to help us become unstuck from feelings that we're currently having. The first thing she talks about is showing up. In showing up, what she means is this, is that we need to be able to identify our thoughts, our emotions, and our behaviors, and we have to face them with curiosity and kindness. What does that mean? sometimes we walk around with this feeling of anxiety or dread or fearfulness. And we feel it, but we don't take the time to stop and say, why am I feeling this way? Now, look, most of the times it's going to be obvious you're feeling this way because of the pandemic, but what specifically is it that is affecting you today? Is it the fact that there were 4 call-outs and you're struggling to be able to get people in to be able to help? Is it a finance thing? Whatever it is, identify that. It's the first step in this process to be able to identify what it is so that we then can protect ourselves from the feelings and so that we can do our job. Next, we need to understand that these feelings that I'm talking about identifying, they're going to be coming at us at a rapid pace, because in this environment, we are individuals that have lost people. We're losing patients, we're losing friends, we're losing coworkers, neighbors. And for some of us, we've lost family members. And that's a real challenge. Next, we also have to understand that not only are we experiencing loss in our work environments, we're also losing things at home. There are social losses that contribute to these feelings. The loss of human connection. My daughter has lost her entire senior year, and what goes with that is prom and graduation. That's a loss, not only for her, but for me, because I look forward to that as well. Loss from, I'm a big sports fan. Weddings, even funerals. We have lost normalcy in our life. And so we are going to experience emotions. But right now what's happening is we're so focused on the job that we have that we're not in touch with what those emotions are. That wave will eventually come at us. And so identifying those thoughts now will truly help us process it in the future. And we need to understand that these losses that I talk about, some of them are delayed losses. Losses that, it didn't happen now, but will happen later. But some are gone forever. Experiences that are gone forever. And that will weigh on us. The next thing she talks about is stepping out. We've identified the feelings, but now what we must do is we must acknowledge that feeling and accept it. Understanding what you're feeling is therapeutic. Even though it means sitting with the discomfort of the pain that you will inevitably feel. We are so quick to move away, run away from negative feelings because they're scary. They don't make us feel good. But the reality is if we can acknowledge and accept what we're feeling, then we can make it therapeutic, even though it's painful in the beginning. Once we accept what the feeling that we're having, then we need to detach from ourselves and then observe it for what it truly is. And what it truly is this, is that thoughts and these feelings are just emotions, and no emotion lasts forever. I mean, just think about your life. There have been times in your life that you have been incredibly sad, and there have been parts of your life where you've been incredibly happy. And those emotions in themselves have not lasted forever. As a matter of fact, those emotions, eventually what happens is those emotions become less intense, and sometimes we process them and we move on. We may be happy today and sad tomorrow. And this too, these emotions we feel are not permanent. And we need to remember that. Emotions can't be controlled. So don't be ashamed of the emotion. If you're feeling guilt or shame that you didn't go in and help your fellow caregivers because you didn't feel good and you were worried that you had the coronavirus but you couldn't get tested, that is an emotion that you can't control. Don't be ashamed of that emotion. Understand that it is a normal part of what we are going through. Next, after we do all those things, we need to walk our way. And what does that mean? It means allowing our core values to be our compass. We need to be able to understand that we need to use our values to be able to continue to move in the right direction, and that is away from the negative feelings. We need to sit there and we need to say to ourselves, who am I? What are my values? Am I resilient? Am I relentless? Am I adaptive? You need to understand what your core values are, identify them, and retain them. We are going to use them in order to move us through this process. We need to be aware as well of our negative tendencies and avoidance issues. You see, we have good core values, but there are some things that we use to be able to deal with emotions that we don't feel comfortable with. And so what we do is we have negative tendencies. Like, for example, sometimes we jump to conclusions, or we overthink processes, or worse yet, we rely on vices to help us through difficult times. Be aware of those negative tendencies and try to avoid them. And then finally, get back to the why. If you are challenged to figure out what your core values are, if you're saying right now, Charles, I don't understand what you're talking about, I just ask you to do one simple thing. Ask yourself why you became a nurse. Why did you get into healthcare? There are reasons why you did that. There are values that you possess as a nurse that make you feel thankful for what you do. What kind of nurse are you and why? In that are your values. Use them to help guide you through this process. And then finally, once we get through the identifying, the acceptance, the acknowledgement, the detachment, and the observation, we need to be able to course correct. And that sometimes will take a long amount of time. Don't try to correct it all at once. Don't say you shouldn't be feeling this way. Find small, deliberate tweaks in your mindset and your habits to be able to help you move forward. And that may mean that you may need to completely reset. You may need to turn off the noise. Find comfort in familiarity. For me, my familiarity, when I'm feeling this way, is music. And yes, I'm going to admit, yes, I like to take hot baths. But yours may be exercise, it may be crafts. Whatever it is, you need to take the time to identify what your reset mechanisms are and use it. And once you do that, you're going to be able to slowly start to process the feelings that you're having. Now, I want you to be able to, if you want to do this, you can do this tomorrow. Go in tomorrow, and as a daily practice, I want you to do this for me. I want you to check your emotional state several times a day, whether that means setting a reminder on your phone, on your watch. Maybe you say in the morning when I get there, the day before I leave, and in the middle, you're going to check your thoughts, and you're going to identify what your emotional state is at that time. Now, it may not be a bad thing, but I just want you to get into the habit of being able to do it. If you feel unsettled at that time, then identify, acknowledge, accept, detach, and observe, and then figure out how to reset. And sometimes it's hard to do it in the middle of the day, but sometimes you can find ways to do it. What works for you? Sometimes people do breathing exercises. Some people will do something called grounding, where they sit in a quiet space for 60 seconds and start to label and look at objects in the room and label them. What are they? Now, the process there is that the simple thing that you're trying to do is you're trying to break the cycle of this thinking by simply doing things that are factual. That is a table. That is a chair. Sometimes I'll even spell it, chair, C-H-A-I-R-E. Deep breath, then name the next one. To stop the progression of the thought process. And then finally, pay attention to which thoughts and feelings that you avoid. We are all good at avoiding things. And so understand that if you feel something coming on and you avoid it, if you can pay attention to that, then awareness is key and you're on your way. So as I said earlier in my presentation, we are in the beginning of this. And as we move forward, there'll be a time in the future where we will have to deal with the aftermath of our pandemic response. The emotional scars left by this crisis will be deep for some, delayed for others, while some won't even be affected. And I fear that there will be others that will be affected but won't speak up. And those are the ones I worry about the most. You see, there will be an readjustment period for all of us. Healthcare workers will need to commit to making personal reintegration a priority. But there are things that you can do to help with that transition. So let's talk about those. Dealing with stress in the aftermath of the outbreak. There are things that we can do. Number one, as leaders, I talked about this earlier, frequent check-in with colleagues. I'm talking, and I know it's hard because you're putting in many hours. You're putting in 12, 14, 16 hours. I know it's a challenge. But this is an important part to help your colleagues process this. And sometimes, even if you can do it from home, you can do it virtually. You don't have to stay 18 hours to be able to do it. I mean, you could do it from your home. Maybe you pick one a day, whatever it may be, but make that effort. Next, we have to start thinking about what's going to happen for as we gradually reintegrate into this is what's going to happen with personal life. Many people have vacations. Many of them aren't using them right now. So the year gets shorter and shorter, and yet there's personal times that people have to take. We need to understand that this is going to be an important thing for them to be able to have that time. So how are you going to deal with that once this starts to subside and everyone wants to take off? We also have to look for signs of negative coping mechanisms, because that is a very important aspect of how we need to be in front of people exhibiting behaviors that we're worried about. For example, if people start to work too much, that sometimes is a sign that people are starting to absorb within the work in order to stop their thinking. It's busy for them. And so that helps them cope. It's sometimes, though, that could be too much, and it could be a negative coping mechanism. Some people may not show up at all, and there's absenteeism. There will be people that will experience change in their personality. They may have frequent outbursts. And then also, there will be some people that will negatively assess their work contributions. They won't see the value in who they are or what they do. And that comes to my next point, and that is observing for signs of moral injury, because I think this is a real risk for many of us, because moral injury is a real thing, and I think that many of us are experiencing it today. So what is moral injury? Moral injury occurs when we perpetrate, bear witness to, or fail to prevent an act that transgresses our deeply held moral beliefs. In the healthcare context, that deeply held moral belief is the oath each of us took when embarking on our path as healthcare providers. The challenge that we have today is that we are caregivers, and it's what we do. It's what we got into nursing to do. And there are many decisions that are being made today that go against who we are, and that is a conflict. We feel conflicted. I mean, when somebody dies in a room by themselves because no family can be at their bedside, that causes conflict. When we use long tubing and place all of our IV pumps outside of the room, it dehumanizes the patient experience. That's something that we are not used to. We feel morally injured. When we use workarounds to provide care because there's lack of resources, we feel as though we're not doing the best job possible. We're conflicted. Or for me, I mean, I don't work at the bedside anymore. I'm not in an acute care setting. But for me, I have those skills, and I have felt guilty for the last couple of months that I can't contribute more. And so this is my way of resolving some of that injury by being able to provide some kind of knowledge that hopefully will help you. So moral injury, another thing we need to understand about this is that there are additional losses that are occurring in our life that add to our inability to not deal with the moral injury. And what I'm talking about our daily work, our daily structure. Everything in our life is different than what it was before. And so that is challenging for us. Sometimes I don't know what day it is or what hour it is. I mean, our norms are gone. And for some of us, we have things that are occurring in our lives. I mean, some people have others in their life that have lost their job, and it's created serious financial despair, and social contacts are reducing. All of these things lower our defenses to moral injury. And so indirectly, it affects us in our work environment. And that is important. So when we talk about moral injury, we need to talk about what are some of the symptoms that might be present for us to understand that this is something that our colleagues are going through. Well, this is quite often, those who experience moral injuries often exhibit common signs like these. Number one, they have the inability to self-forgive. They take these feelings of guilt and shame, and they're unable to forgive themselves. And for some, it causes incredible depression. And for others, it's embarrassment. Whatever it is, our ability to be able to say, look, this process, what has happened, is out of my control, and that our inherent nature to be able to be nurturers, to be patient, to provide patients with the best care possible is very, very difficult to forgive yourself when you're not able to do it. And we also have what happens, we also see in moral injuries that people have the inability to prevent their mind from clouding over with unwanted emotions. People just break out and start to cry for no reason at all, and they can't explain to you why. And then finally, some people go one step further where we start to really get worried about them, and that is when they start to experiencing self-punishing behaviors. And we're going to talk a little bit about that in a minute. So the question is that people that are experiencing moral injury, identifying the symptoms is the first step to helping caregivers heal. But therapists have also suggested that we reestablish normalcy in our best way possible. And this is one way to be able to help with that. Reestablish a sense of community among clinicians, finding ways to be able to bring clinicians together in maybe virtual experiences, or even within our work environments. We need to be able to make sure that we're continuing to establish those relationships, because these are the individuals that truly know what you're going through. They can truly empathize with what you are going through at this time. We can also understand and help caregivers process the grief, because in moral injury, there's a lot of grief that is involved. We can help caregivers to understand that grief is normal. It's a normal process. And that after a loss, it can be lightened, but it can't be eliminated. Eventually it will go away, but you can't just turn it on and off. That's not how it works. Each individual's personal experiences differ. Some people experience grief in one way and some experience it in others. There is no recipe to this. And so we need to be aware of everything that is going on within our work environment. And then finally, we need to help people to understand, don't be surprised if you start to feel numb. That things around you are just, they're unreal. You don't truly know who you are. Again, this is an important step within the healing process. It is your brain shutting down and telling you that you can't deal with it right now. That's okay. We need to identify it, acknowledge it, accept it, and then detach and observe and help our core values get us through that process. And then there are some that I worry about because they're just going to avoid. They're going to avoid their emotions. They're going to suppress those feelings, which then later on will manifest themselves in some kind of negative self-destructive behavior. And that is when intervention is needed. And so, everyone knows about PTSD. So I'm just going to talk a little bit, just a few minutes about PTSD. But before I do, I want to talk about what other people have learned. What have other people that have gone through this have already experienced that we can use as our knowledge to be able to help us be the best leaders possible? Well, let's talk about, I skipped ahead. Signs and symptoms of post-traumatic stress disorder. I think you all know these: severe depression, insomnia, numbness, exhaustion, and of course, suicidal thoughts. So let's talk about those studies I was referring to. There's a study that was done that came out of Wuhan, China. It was 994 nurses and doctors that were involved in the response to the pandemic. And what they found was that nearly 37% reported a subthreshold mental health disturbances. So at least 37% of those individuals had some kind of mental health issue. 34% of that group had mild disturbances. 22.4% had moderate disturbances, and 6.2 had severe disturbances that required intervention, including hospitalization. So this is real, and it's something that's possible. So we need to be on the lookout. Let's talk about one other study that came out of Italy. And they did a study, and the study was of 1,300 healthcare workers, and 50% reported PTSD symptoms. And I found this quite interesting in terms of who experienced the PTSD. And so people that were of younger age tended to have symptoms of PTSD more than their baby boomer counterparts. And so I found that quite interesting and something that I would have never thought would have been the case. Of course, they said that more females, now this may be a fact that there's a female-dominated profession. So that's that. And then people that knew a deceased person or someone who knew someone who was hospitalized had an increased exposure or increased risk of experiencing PTSD. And the problem with PTSD is this, is that you may experience it immediately, but sometimes you'll experience it later on. And when that is the case, then sometimes because we're so far removed from the actual experience that we can't explain why we're feeling that way. And that is a real challenge. I'll give you a quick story. When I was a manager of the emergency department in a hospital just outside of Philadelphia, we had somebody that came in and wrestled a gun from a police officer, pulled it out, and he shot 3 people. He shot a police officer 3 times. He shot another officer once in the chest, and he shot one of my ER techs in the neck. And I remember the trauma of that event. And I remember being a leader, being stoic, and I'm going to be here for my staff. And I immersed myself in my work to protect myself from feeling the pain that I was feeling. And so I remember that happened on September 29th. And on October 20th, I was having a Halloween party at my house. And I had invited a bunch of people. And on one day, 3 people wrote me and told me they weren't coming. And I remember sitting at my desk crying. I mean, not just sobbing. I mean, like the kind of way you go, you know, that. And I couldn't stop and I couldn't understand. And it wasn't until I seeked out, until I went to a counselor that I understood that this was a delayed response, a post-traumatic stress that I didn't know. And because it just hit me all of a sudden. So understand that these things that I'm talking about today may have to be used now, but also may need to be used in the future. And so, of course, PTSD, there's things that you can do now for that. There's critical incident stress debriefing teams that many counties, towns, states have that you may be able to utilize to help you in this battle. There's, of course, employee assistance programs that most organizations have some connection with. And, of course, there's full-time counseling that you can do to help your fellow coworkers. So I'm nearing the end of my time. But before I go, I want to leave you with something positive. Because one thing that I'm always amazed about is that I am always truly amazed about how healthcare always rises up to a crisis. As always, at times of crisis, nurses always step up to the challenge. While there has been a lot of trauma and sadness and anxiety over what is going on, there have also been many, many rays of light. So I want to talk a little bit about that. But before I do, I just want to put up this quote because I love this quote and I think it's very appropriate for us. And it's this. It's adversity does not build character. It reveals it. And I truly believe it. Because if you look at the things that nurses are doing in today's very, very hectic crisis, I am simply amazed. What am I talking about? Well, let's talk about innovation. Nurses have been on the forefront of innovation in this fight. I mean, there are 3D printers that are making these mask holders so that it prevents breakdown behind the ears. There are these plastic boxes that nurse anesthetists are using to prevent exposure to people who may have the virus. There's this. I didn't even know what this was. This is a massage pad that is used for women that are in their 3rd trimester of pregnancy for massage. There are hospitals that are using this to prone patients because they don't have enough roto-prone beds. And then this was something I thought was wonderful. These are masks that are being made so that people can communicate with people who are deaf, who read lips. The innovation is incredibly amazing. Honestly, I'm so proud to be a nurse when I see these things. Next. Oops, sorry. Got too excited. Next, let's talk about the humanity and kindness that we have witnessed. I mean, there are food banks that are giving out food to tremendous amounts of people, supporting them during this crisis. You have food. I cannot tell you, my colleagues that I worked with at the last hospital where I was the senior nursing director, I mean, they get food every night. I mean, the community has really stepped up. And think about it. These are businesses that are hurting themselves, but are they supporting the healthcare workers on the front lines? There are people that are making masks on their sewing machines at home. And of course, there's the humanity and kindness of our nurses and the celebrations and the wonderful things that they do for patients who survive this awful, awful virus and that go home because of the care that they received. And then finally, the love and support of each other. honestly, the support of each other. I've seen so many wonderful stories and so many examples of how nurses have stepped up to help nurses, and how hospitals have done things to be able to support their frontline caregivers, or first responders who are acknowledging the risks that you take every day when you walk through those doors and you face a virus that could potentially kill you. I mean, truly, it is admirable. And I can tell you that I have never been more proud to be a nurse. And I thank you for all that you do. I hope that today was helpful. And I say to you that as we move forward, remember, the emotional trauma that is coming will be important to address, be aware of. But if there's anything that I know, there's nothing that I know more than this, is that we are able to do it. We will do it, and we will get through this. Thank you so much for having me.
Before our question and answer session begins, I would like to remind attendees to submit the state or country they live in using the questions feature. Charles, you mentioned remaining calm for others, and so that others don't feed off my emotions. I do not want any of my staff to mimic my feelings. Do you have any additional strategies and resources to use in these high stress situations?
Well, it's hard to be able to determine what you can do in the midst of what is going on. I had a colleague that when I've gone through certain times in my life where work was very stressful, or things were going on, having that colleague that really is there for me, that I could call at a moment's notice, that I could walk into their office and just scream or cry. That was really, really important. That's the first thing. Second thing is that when you're not at work, I mean, truly finding what your coping mechanism is at home, and making sure that you do it. Finding those opportunities to really resume a sense of normalcy in your life is really important. And, for some of us, wine is another good thing that I'm just kidding. I talk about vices that we shouldn't address to. But, I mean, honestly, if you can find ways to be able to make those social connections, I mean, I love it. I mean, every Friday and Saturday, we have a friendship hour where I find somebody I haven't talked to in ages, that I just randomly call up or FaceTime, and we catch up. And there's no better time now to be able to do that. And so those are the things that I have found help me, and maybe they'll help you too.
Thank you. As we process and work through the losses, whether they're at home losses or at work losses, what if we feel there's no end in sight? I do not want to remain in the sadness, the hurt, or frustration. Is there a time frame to give myself?
It's so individual in terms of how you process grief, how you process the trauma and crisis. You know who you are, and that's difficult to be able to answer. Look, I think that there are some positive things that are going on right now. Today, there was positive news that came out of Gilead that talked about remdesivir and the positive effects that it's having on patients that actually have the virus. There are a number of clinical trials. I think there are over 90 clinical trials that are going on now for possible vaccines. There is obviously, as we look at our environment, there are significant numbers that show a flattening of the curve in hard-hit places, like New York is flattening the curve, and they're doing it through, common sense social distancing and those kinds of things. And so, I mean, I encourage you to look at the positive things. It's so easy to get pulled into the negative aspects of what is going on around us, particularly when you've been in it as long as you've been in it and you've been exposed to it. But I challenge you to step back and really start to look at some of the positive signs that are occurring. And again, it all depends on where you live, what state. I mean, I live in Pennsylvania, and the governor just opened up golf courses. He opened up, that's all he opened up, parks and golf courses, because he said in those instances you can socially distance and still heal yourself psychologically. So I don't know if there's an answer to that. I think it all depends on who you are and how you effectively go through it. what I think is important is that you understand what your coping mechanisms are, that you reach out to people who you feel are your support, and that you look at the positives that we see currently in this environment, and where we're moving, we're moving in a positive direction.
Keep those questions coming. One ongoing struggle for me is having to message the level of protection offered by surgical masks when I personally believe the evidence supports I need to wear an N95 for protection. How do I, as a leader, deal with the moral distress of having to give this message to our team? I feel like I have to spin my messages.
Yeah, that's rough, right? Because I talked a little bit about the things you can control and things that you can't control, and this is one thing you can't control, right? The products that you receive at your hospital and your ability to be able to use N95 masks in this situation are only controlled by the product line and whether or not you're able to get those things. And so, one thing I think that's important to do is to be able to acknowledge people, just as I said that you have to acknowledge your own fears, I think it's also important to acknowledge the fears that they may be having. And I've always found that as a positive thing. If I can go up to somebody and acknowledge a feeling that they have before they even tell me, we suddenly create that human connection because they look at me and say, you get it. And so you can't change what you can't change. You can't control that. But what you can control is your reaction to it, which should be supportive, should be someone who is there to be able to listen to their fears, their anxieties, to be available to check in on them when you think that they've had a hard day because you've picked up those cues by emotional things. And your own self is to be able, I know how hard it is to go out and sell that message. As a leader, we just as caregivers have moral injury over the fact that they can't provide the care they want to deliver, leaders have that same challenge. Most of us became leaders because we love being leaders. We became leaders because we want to be able to help others be the best at who they can be. And you almost feel as though you're letting them down. I get it. I don't know what you can do. I think you just need to process those feelings individually. I think you need to be honest with them and tell them and acknowledge what they're feeling, but there's things that you just can't control. And understanding that and working with the things you can will help you process it and get through it on the other side.
In resetting my feelings, how do I determine what my reset mechanisms are? Is there a self-evaluation tool, or is it more of a trial and error process?
I truly think it's a trial and error process. I did not know until this year when I got for Christmas a really cool set of earphones that I just loved music. And it was funny one day. One day my girlfriend said to me, "Why don't I make you a hot bath?" And I thought to myself, that is the oddest thing that I have ever heard. What do you mean how's a hot bath going to help me? And you know what? And I went upstairs and I put in my earphones and I shut out the lights and I sat in the warm bath and I did what's called triangular breathing, and it worked. And so I didn't know that. So that's a trial and error process. I know that for me, exercise helps me to get rid of that stress. It allows me to remove myself from my brain because I have to focus on the exercise that I'm doing. I play ice hockey and I love going to ice hockey because as a goalie, I have to be sharp, but I have to be sharp for a different reason. I have to be sharp because I need to be in the right position or in the right area to make the save. And it breaks that cycle of obsessive thing. I'm an ADD guy. I'm a type A personality. I don't know if you can tell, but in order to break that cycle, I try to remove myself from the stimulus and then find something that's going to stop my brain from thinking that way. I believe it's trial and error, and I think it's something that you really got to try. And some things will work, some things will. And you know what? Some things that work today may not work tomorrow. So it's trial and error. I think that's the right way to look at it.
How do we know when we are healed from moral injury?
I don't know I think that it's a gradual process. It's not an on-off switch. What'll happen is that our world will start to return to normal, and that is going to happen over a course of time. It's not going to happen tomorrow. It is going to be a gradual process that goes over time. And I'm going to be honest with you, there may be some regression during that transition. We may go 4 steps forward and 1 step back. We may move forward, and then when the fall, winter comes, and this comes back, and it will probably come back, we're going to regress a little bit. But what we always have to do is look forward. Where we are today, even though we went 4 steps back and 1 step back, even though we went 4 steps forward and 1 step back, we're still 3 steps ahead of where we were before. And so this is something that nobody has ever gone through. I mean, I don't know anybody working in healthcare today that experienced the Spanish flu. I mean, this is uncharted territory for us. And so I really think it's just going to be a process. But what you can do for yourself is this. Don't put the expectation on yourself that it's going to happen tomorrow, that one day you're going to walk into work and it's just going to change. It's not. It's going to be a progressive process. But what is important is that we do it together. We support each other. There is no one in your life that understands what you're going through more than the colleagues that you're working with today. And so use them, help them understand the process and move through it in a timely yet, move through it in a timely fashion.
Thank you so much to our presenter today for all this great information. Sigma is grateful that you took the time to share with this audience, and we look forward to hearing more from you in the future. As a reminder to our attendees, please submit the country or state you are from in the question feature, and thank you to our attendees for joining us. Have a wonderful evening.